We are continuing our discussion about mental health in the NICU
I
at the
love the focus here.
CHNC. Yeah. But we're going to take a little bit of a spin here, a spin off. I have Dr. Chavis Patterson, a psychologist, coming to us from the CHOP NICU. And you're going to talk to us about, we've been spending the morning talking about parent mental health, family mental health, infant mental health. But what about the mental health of our healthcare team?
Mm.
Right. Yeah, that's true. And, CHNC has been really great to include mental health in terms of the patient
Mhm.
families, but also spending time talking about the mental health and of the staff who care for the babies, in the NICU. And there was I guess, a pre-conference symposium where we really focused on, mental health, creating programs within the NICU, supporting the growth of the NICU and to include psychologists and psychiatrists. And my particular part of that was talking about staff and staff self-care, staff mental health. And, we talked about, stress, de-stress, compassion fatigue,
So you're saying neonatal healthcare professionals get stressed out by their work. Is that what you're saying?
So it's funny you say that. There's a quote that I usually start off
Uh-huh.
with, and it's a quote by I'm just going to read it. Rachel Remen from the Kitchen Table Wisdom,
Ah.
and she said, in terms of the work, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet.
Oh my goodness.
Oof. Let that sit
I
with you a little
know.
bit.
So again, I totally agree with that. Again,
Mm.
we work in an intensive care unit. We deal with a range of very intense situations. And again, on the extreme is death and dying and grief.
Mm.
And we walk the journey with the parents. But we don't always take time to think about the impact that it has on us as healthcare professionals. So part of the work that I do at CHOP, not only to care for parents, but also think about how we can care for staff. And we have a great infrastructure with the medical team, with the nurses, the social workers, and we have different mechanisms to do debriefs to follow up after a particularly difficult case. Um, but what we talked about in the pre-conference symposium, we talked about, well, what does it look like? Stress is good because it motivates us to study, to work harder, to do things. But when it gets to a level that it becomes detrimental to our own either physical or mental health, some people call that toxic stress.
Mm.
Um, but then there's the piece of compassion fatigue, right, where we get so involved, so immersed in the work that we do, it really starts to impact us. And, we look at how it impacts us physically, mentally, emotionally, not only just with ourselves, but in our interactions with our colleagues and also with our families. So,
Yeah.
again, we talked about how, as care providers, we really need to be aware of that. And be aware of the impact. So we talked about, again, the emotional impact, the psychological impact, the relational impact, and what it might look like, be it sadness,
Mm.
irritability. I like to call prickliness.
Mm-hmm.
It can impact, your eating, your sleep habits. It can, give you sort of little GI issues. So it really can come out in many different ways. So, you need to recognize it. And you need to think about, well, how can I, work on combating that? And, in our profession, we have some amazing folks, and some people don't like to think that they're impacted by their work.
Mm.
And when, I talk to my colleagues, and then some of the other folks that in the group talk to their colleagues, he said, well, why isn't it you talk about some of the stress that you encounter. And, they came up in different categories. There's sort of the self-blame, it's just me. No one else is going through this. It's just me. Or the shame, they're embarrassed to admit that, this particular family or this particular case, touched them in a way that made them more vulnerable.
Mm.
Um,
Mm.
they talk about, oh, I don't want to burden my coworkers. All right. Or I can't expose that I'm weak. Right. There might be a weakness there. And then some people say, look, I can't take the time to, take the time off. I need to work. Right. So we talk about all these different ideas that people have about why they really can't stop, take a moment and pause to say, wow, something is going on.
Mm.
And I think I might need to address it. So again, in our session, we talked about strategies for addressing that. And it was on a personal level as well as a professional level. So we talked on a personal level. We talked about, trying to adjust your schedule, and change just little things. It's not like,
Mm-hmm.
changing your entire schedule, but maybe, you're taking 5 minutes in the morning as you come in, to just kind of think about, your day and what you have ahead of you and be planful about that. Maybe it's on the way home. You take an extra 5 minutes to take that walk, or to listen to some music. But really talk about little moments during the day that you can, things you can do to take care of yourself. And, we talk about, regular exercise, relaxation, nutrition, but can you sort of sneak those into your day? And we talked about that. And then it can reach the level of, well, if it's really impacting you and your relationships, we talk about psychotherapy.
Mm.
So connecting with a licensed professional to really have an opportunity to talk through them, and say, well, why did this family touch me in a way that maybe another family didn't touch me? So really trying to get an understanding of, sort of what's going on with you, and what can be helpful. On a professional level, we talk about taking advantage of, your HR department and any resources that they might have. We talk about, peer consultation. Again, at CHOP, we have a session. It's called Pink Flags,
Mm.
right? It's when an issue doesn't reach the red flag level, but it's percolating.
Yeah.
So let's talk about this, and let's get all staff together, not, just neonatologists, but let's get the neos together, the social work, the nurses, the PT, OT, and all the folks that are involved in the care. And let's talk about this, and how are we going to approach, this family or this situation in a collective way, in a team way, so that we're taking care of ourselves and we're recognizing that, yeah, this is a tough situation.
I've actually been privileged enough to take part of some Pink Flag meetings because I'm at the same institution as Chavis, and there is such a catharsis to being able to name some of the things that are, I like the word you use, percolating below the surface, that are, it's that drip of water, or maybe it's the trickle of water that's
Yeah.
really eroding at our resilience and our mental health. And being able to name that with people who understand and have been in that same context, there's something really powerful about that.
And we always talk about, when you're in the room with the folks that know that case, everybody gets it.
Mm.
When you're talking to your partner, or when you're talking to, say, your best friend, they don't necessarily know the day-to-day of the NICU, or even the cumulative. I mean, again, in some instances, you'll have multiple situations that are stressful, and they just sort of accumulate. So it is nice to hear. And I think it is also nice when we have these multidisciplinary sort of debriefs. It's nice to hear, that the neo, was a little, stressed, or the bedside nurse or the nurse leader, just really normalizing that, hey, yeah, this was a difficult case and everyone was having, some challenges, but hey, we can get through this together. We've done it before, we're going to do it again.
I mean, I think the undercurrent of your messages are really that these are normal human emotions, and nobody is deficient because they may be struggling with some of those complex emotions at work. And just because they're normal doesn't mean that we shouldn't do something about them.
Correct. And, we say this to the families who
Yeah,
come through the NICU.
absolutely.
This is a normal reaction to an abnormal
Yeah.
situation. So let's talk about taking care of yourself. So, we say this to the families. We encourage them to do that. Why, shouldn't we do that for ourselves?
And the other thing I'm hearing is, as we do with families, there's strategies and tools and considerations on an individual level,
Mhm.
maybe even resources within the community, right? We're hearing this theme of community, the NICU community, which is something I really want to push, is we are a community. Community exists even within hospital walls. And then there's, structural strategies
Right.
and tools to really combat this pervasive issue, the stress both of our families, but of our healthcare providers. And um, we are fortunate within our institution to have access to some of these structural strategies, like access to you and your team. But I was hoping you could talk about that, because I think we also need some of these kind of healthcare and system investment strategies to help with this issue.
Well, again, I agree with you. CHOP is an institution that, is really fortunate in being able to provide a breadth of services, not only to the families, but also to the staff.
Mm.
And again, we have a great psychosocial team. We have, psychologists. We have great social workers, child life,
Mhm.
chaplains, OTPT, child life. I mean, we have a great group of folks, and we do take time to say, yeah, that's a challenging situation, and we find times, to pause and to reflect. And again, I think that's important.
Yeah, I'm recognizing that our community, as you said, is starting really to think about these mental health impacts on the families, and hopefully we will start to really recognize on the mental health impacts on ourselves, and moving the needle of making a psychologist in the unit the standard of care. And now psychologists have been doing this for some time, right? You guys recognize that this was a need that our community had. How can neonatologists join kind of the advocacy efforts to see that become a standard of care, say for level 3 and 4 designations, NICUs?
Well, I think that it was great that CHNC has formed a focus group for perinatal mood and anxiety disorders.
Yeah.
I think there is going to be information available on the website. There's also a group. It's called the National Network of NICU Psychologists. Which is part of the National Perinatal Association, and you can go to that website, and there are guidelines and suggestions about how to request or talk to your administration about what it would look like to have a psychologist. And it's broken down, into each step about what the ask is. Right. So what would the job description look like for a psychologist who would be in the NICU? How would the psychologist be paid? Right. What would billing look like? So it's really broken down into different pieces about, well, how do you go about talking to the administration about why a psychologist would be helpful, the benefits of that, and then the structure, just really the logistics about, well, what does the job description like, or where would I post, how would I find out this information? So that information is available also.
And I just want to call out that neonatal care providers, whether you were neonatologists, nurses, or other allied health professionals, we are the content experts to advocate for institutional policy changes around the staffing. And, I think as I hear you talk, we need access to NICU-based psychologists, both for our families and our healthcare providers. So that is a workforce issue that we need to advocate for. And we are the demographic. We are the community that has the lived experience to advocate for that.
And I think that it's wonderful because when you have someone who's based in a NICU, I refer to it as I'm embedded in the NICU.
Yeah.
So I all my work is in the NICU. Other institutions share psychologists with other departments. Well, that works well, but then you don't get to know the community
Right.
within the NICU. So you don't get to know the NEOs, the social workers, the the NPs, the PAs. You don't get to know that community, and they get to know you. It's a little different with a sort of a consult liaison approach, where you're called in for a consult. But here, you can address things sort of before they start, to cause stress among staff.
And more of a longitudinal approach also.
Correct,
Yeah.
correct. And again, my time is split again clinically with patients, but also talking about program development. I've done some great work. I've been invited to work with nursing and talk to nurses about how they're doing and talking about the stress that they encounter, because again, they're at bedside 12 hours a day. And it's really, it can be challenging sometimes. So I've been fortunate to be welcomed by, again, all the disciplines in the NICU, to be able to share, my knowledge, to help them, with the really challenging work that they have.
Well, Dr. Patterson, thank you so much for your work. Thanks for highlighting some things that I think we brush past on the day to day, going through our lives in the clinical realm, the research realm, getting through the day, but recognizing that these things add up. I hope that is a call to action for everybody to take inventory of their own emotional health, the emotional health of their unit, and how can we work together as a community to make this the standard of care for everyone.
Yeah.
Yeah,
Thank
great.
you.
All right. Well, thank you again for the invitation to speak.
Absolutely. Thank you.